And I know sometimes she has to, in the leadership position, you get the slings and arrows and you have targets on your back, but don't think for 1 minute that your efforts have not been appreciated. And having been in the political arena for over 30 years, I know people don't always agree, but it's important that we come together and support this hospital. And I'm sure you'll find the future of St. James is bright. There's a lot of work to do, and it will be done. And without further ado, I will introduce Jen Sullivan.
So when you think about what can you get at St. James, what could you get here before we separated from Trinity, and what can you get here now? And the intent of this slide is to show you that almost all of the X's are still there. So, you know, maternity is the one that we do not have today. I know it was very sad for us and it's still hard, but that being said, we were able to preserve most of the list that you see here, and all the X's are there. We're still open, we're still providing services.
And so it's important that as we look at the emergency room, we talk with them and how do patients get admitted, what are their criteria, and we've been busily talking with the hospitalists, and I see Dr. Rendawa, Tariq is here, and Dr. Robshaw in the emergency room trying to pound out and get through what is it that, how can we make certain the right kind of people come into this facility that we can care for and get them taken care of. Very important, and we've come a long way in trying to make that happen.
Thank you, Jen. With the partnership with the U of R and St. James, was there a clause in it that a new hospital would be built contingent on the partnership going through, and that new hospital would be built in the North Hornell area, the Mercy Care area?
There is a plan to build a new facility. The answer to that is yes. Part of that is the state plan I was talking about, that multi-year transformation plan. And we need to obtain funding to build that building. So really that's the next step, is to continue to secure the state support. It's a pretty expensive building, and we're going to need a lot of the dollars that have been placed aside for healthcare reform and transition for that. So the plan is, yes, to build a facility. The site we're still looking at is the one in North Hornell next to the nursing home. And the reason we're looking at that is we're trying to create a medical village where all the services we provide are on one campus. And then when you have everything on one campus, it makes it work better when you're handing off from one provider to another.
One of the reasons we want to bring practitioners here from other communities is we want to see as many patients not go to Rochester, or frankly to us, if they can be provided services here. It's better for families, it's better for your community. And to be very blunt, Strong Memorial, which is 860 beds right now, we're talking about doing some expansion, is over 100% occupied. It is we are assuming, we're planning now for the next few years occupancy, we are assuming that we're going to be able to push on the average 25, 30 patients that are inpatients in our institution back to local communities, whether it's in Canandaigua, whether it's here, whether it's in Dansville, whether it's in Wellsville, wherever that might be. Our goal is to push as many patients safely and appropriately back to local communities where it's much easier for them to facilitate their care.
So there's been a lot of nice things that have been talked about tonight that are coming back, and you're exploring what other services we need. But in your discussions, has there been any discussion about mental health services? We had an inpatient, adolescent, and adult psych units here for a number of years that served a great purpose. They're gone. And to the CEO's comments about the effect of services on families, that they've got to go someplace else for those services, assessments and things, I wonder if any of that may be coming back, or the discussion around those services.
So the answer is yes. I wish I could give you a solution for all that we need right now, but I can tell you this is one of the things that is hot on the list.
Maternity. Now both of those have been restored, but still nothing's been talked about with maternity, and we're just wondering, where that stands.
But right now I can't tell you that there's a plan to bring OB back right at this moment, to be very honest with you. But I can't tell you that it won't be something that could be done in the future as well.
Here Do they have to reapply every year for that funding?
We do have to reapply, and we do that every 3 years, I believe. We'll actually be coming up for that application in 16. We're presently funded for the operation here through the end of 16. We'll make application in June, July timeframe next year, and that will be granted for 3 years.
In the event that the funding in the future doesn't come to fruition, would you still make the commitment to Hornell?
Yes, I mean, we were making the commitment to Hornell before the grant came through, and, you know, with some significant efforts. As mentioned, Congressman Reed's office very helpful in getting that grant. But we were coming, and we think that there can be a viable practice here, and we're now looking at dental services.
I want to say, let's all get together, and I like what I'm hearing, and I think you're going to do us a great job. Thank you.